Yeah, there is, Brittany. It comes from the expert analysts at OHSU, and it has hospitalizations in Oregon peaking this weekend. Finally, a light at the end of the Omicron tunnel. The highly transmissible variant is showing signs of waning, says OHSU's Peter Graven.
It's going to bounce around a little bit, probably for this week and maybe into next. But I do expect a decline. I'm not seeing additional surges. I'm not seeing any increases in cases in particular to worry about there.
The encouraging news is important for hospitals, seriously strained but not broken. As of Thursday, Oregon had 1,087 people in the hospital with COVID. And Graven says the peak is here, but that does not mean things immediately get better.
We still have very high case counts, and that's reality. Even on the way down, you can infect just as many people as you did on the way up.
Still, Graven says Oregon, which is the blue line here, is doing better than most of the country, where the hospitalization peak was more than a third higher on average.
And a big part of that actually has to do with the actions people took. Our masking rate is high compared to many other states that tried to kind of rapidly catch up. Also, we took behaviors when other states were getting hit and didn't wait for it to hit here.
After this weekend, the forecast's red line shows we should see a continued decline in Oregon's COVID hospitalizations, falling to pre-Omicron levels by the end of March, then down from there.
We're hopeful that we are seeing the start of that downward trend.
Jonathan Modi speaks for OHA's Public Health Division. We talked to him about how the forecast plays into deciding on continuing mask requirements for indoor public places. A decision must be made by the end of next Tuesday when a temporary mask rule expires. Modi says, based on where we are now, some type of replacement rule is likely.
So, changes could be made. It could be, basically the temporary rule as we came to know it. There could be adjustments in the language.
And so a new mask rule is likely, and when it comes down, it will be called a permanent rule, but just like the one that was put in place for schools, that does not mean it will last forever. Health officials can end it when they think it's safe to do so. Ashley?